Greetings and welcome to In-Depth. I'm Dike Rostant. We continue the conversation started with sexuality consultant and sex coach Onika Henry, looking at September as World Sexual Health Month. How you doing, Onika? Thank you so much for joining us again.
You're most welcome. Glad to be back. Glad to share.
And the last time we were speaking, it's almost as though we stopped right when we started to speak about some of those myths that are associated with sexual education, looking at the fear of it and at various levels. So can you take us through some of that in a little more in-depth, pun intended, thanks?
Right. So the fears around sex education, as far as I can tell, are centered around beliefs about what the content will be like. So one, there is a belief that sex education means our young people are going to become more promiscuous. So if we teach them about sex, they're going to become promiscuous and they're just going to go out there and try to experiment and do all kinds of things. And that is not how education works. It always surprises me that somehow folks place those of us who study sexuality in a whole different bracket compared to teachers who teach French and Spanish and math and geography, as if we are out here to create mayhem and havoc. We have the same goals as those other teachers and those other subjects to make sure that our young people have the skills, have the knowledge to navigate their world in a way that is safe and healthy for them. We're not out here looking to create a space where everybody just has just wanton, irresponsible sex. That's not good for us. We have children too. I'm a parent. And so I wish people would begin to recognize that those of us who are properly trained, we look at, as other teachers do, developmental age and stage, and what does a child at this age need to know to keep themselves safe and healthy. And so for every age and stage, there will be more things they would learn. So, for example, at the last show, I spoke about consent starting at age 3. And of course, information about consent is going to change and become more complex when they get to age 7 or 8, and when they get to pre-puberty and when they become adolescents. All right, because consent is now going to look different, and their age and state demands that the information and skills they have changes. So that's one thing. And the evidence has been showing year after year after year for decades and decades that when we give young people proper, accurate information, they make better decisions. They will choose to have less sexual partners. When they do choose to be sexually active, they will practice safer sex. When they are beginning to become sexually active, they'll negotiate with a partner for both of their health and safety. And they actually delay the sexual debut. Because when they recognize the challenges, the responsibilities, and all the things you need to do, when you become sexually active, they're like, okay, hold up, I'm gonna back off on this and I can wait. Yeah, and when they do decide to be active, they are able to do it safely and they're able to negotiate what they need and what they want from a partner. That's one. Another challenge of fear, I think, is based on the belief that when you're teaching children sex education, they're going to become more permissive. Meaning, so I'll be frank, part of what we teach in sex education, a lot of groups, particularly religious groups, have a challenge with. And so, in parents' minds, they're thinking, we're going to be teaching them about sexual orientation, we're going to be teaching them about solar pleasure and masturbation, we're going to be teaching them about how to use condoms, and therefore they're going to, decide to have premarital sex, and that's not something the religion believes in, etc., etc. We're going to be talking to them about abortion and contraceptives, all the things that raise fear and concern in the adults or the parents or caregivers. And the fact is, when we teach about all these things, we are simply teaching truths about the human existence. Human beings have always had these challenges, have always been of various orientations in many different cultures over time. There's nothing new under the sun that we're teaching. But in terms of how we teach it, It means that our young people are going to be, yes, they're going to be more open-minded because they're going to be exposed to all these truths, but in a way that is not promoting that this is something that they must practice or they should practice, or that, you should go out and try and experiment. We're teaching you that there's always been diversity, and that it may not be for you, but you don't have to bully or disrespect or deny somebody else's their rights because they engage with the world differently or they believe differently than you. And so the exposure to all of these things is to help them be aware that diversity exists, that you can be respectful to others who don't believe as you or who don't practice as you do. And that those persons, once they are not imposing they're not living their life at the expense of others, then they also deserve rights and access to healthcare and to information like anybody else, especially if they're tax-paying citizens.
And I like that comment about one having or experiencing your life at the expense of others. I think in reference to others, looking at where it is you get your knowledge base from. And speaking of that knowledge base, I can imagine that religious pathways or spiritual journeys would have a part to play in the way that one experiences sexual health, in the way that one experiences bodily autonomy. When we hear certain texts saying who is supposed to submit to who is supposed to be honoring who, sex and religion. Let's take the cover off of that a little bit.
Wow, you're being very, very brave. I'm up
I
to
don't
the
know
task.
I don't know if fools rushing in, but
Where angels fear to tread. So I'm up to the task, and I am trained as a sex and faith facilitator, which means that I specifically got skills to deal with and interact with those within the Christian community, especially those who come from that purity culture belief, and how to understand how scripture has been weaponized when it comes to sexuality. I'm not even going to apologize for that. And I'm not going to apologize for saying that, because I see these clients in my practice and how scripture has been used to create what literally looks like and presents like sexual trauma in the body, even though a lot of these folks have not experienced sexual assault or sexual trauma, but the body presents as if. And so one of the things that I do within my training as a sex and faith facilitator, and I was trained by Reverend Dr. Beverly Deal in the US. She's based in Philadelphia in the US. And we literally went through the history of the church. So I did some study on the theology of the Christian church and the scriptures that have been misinterpreted and misapplied, in some cases deliberately, because the idea is to have control over people, to control what they do and how they do and who they partner with and how they reproduce for all kinds of reasons. And that's a whole other big, different, deep conversation. But one of the things that I have noticed is that if you believe that this creator, this deity, frowns upon a certain kind of sex, but your body or the way that you experience your sexuality is not matching what they're saying this deity is expecting of you, that's a huge mental and emotional conflict. And so it doesn't align with what actually happens with human beings. And it doesn't have to be that way. Once again, it's a way in which the leadership has chosen to interpret scriptures. And I'm not saying everybody does that, but it has caused major, major problems. And it shows up in our offices, those of us who work with sexuality and sexual health. And so what we do is we reframe how people think about their deity or their God. We reframe that relationship. In other words, we encourage folks to have that personal relationship with their deity, as opposed to simply sitting in church and just accepting everything priest and pastor says. You are entitled, in fact, you are encouraged based on what your scriptures may say, to have that personal interaction with who you believe is your creator. And so helping my clients develop that intuition of knowing what is right for them, of knowing and believing what is required of them between themselves and who they believe to be their God is their deity, is part of helping folks reintegrate sexuality and spirituality, and seeing sex as something that is a gift from creation, as something that your creator expects you to enjoy and to enjoy well, as an act of gratitude or worship or thanksgiving. And so there are all these different ways of reframing how we see sex and reframing how this gift was given to human beings. And of course, not everybody's gonna accept that or be comfortable with that. But for those who really have that tug of war and it's begun to affect their relationships and even their connection to themselves and their bodies, they come to us for help. How can I engage in sexual activity and not feel like I'm committing a sin and God is going to be striking me dead at any moment in time?
And I really take that point in the sense that using is almost as though using your body as a and sex as a almost thanks and gratitude, especially if you're looking at or consider our bodies a temple. But in terms of people coming to you for that help, we speak to that on the other side of this conversation. Stay with us. Human sexuality consultant and sex coach Onika Henry is with us. You don't want to miss the rest of it. Stay with us. We come back with more. Welcome back. We are speaking about sexual health. We're doing so with human sexuality consultant and sex coach Onika Henry. And just before we took the break, you were starting to talk about the reasons that some persons would come to you, and you use the term sexual trauma. So even before itemizing some of those particulars that you would have people seek you and your services out, Onika, define what is sexual trauma, please?
So let me start with what trauma is, because adding sexuality simply means that the trauma took place at particular sites of the body, right? And so when we talk about trauma really is too little for too long. So that's one kind of trauma. Too much, too fast, or too much, too soon and too fast. All right. And so if you're in a situation where your sense of self, your psychological well-being is exposed to all kinds of messages or lack of messages about your worth, your well-being, if your body is constantly exposed to a certain kind of pain or contact, and whether that pain or contact or lack of contact is too little for too long, or too much too fast, or too much too soon and too fast, then the body is going to experience what we call trauma. And so it responds in a physiological way. It's going to constrict. It's going to prepare you for fight, flight, or appease, or freeze. And when your body goes into those responses, if those responses aren't processed and released, there are psychological repercussions for that, which means that programming, that sense of always having to be in freeze, appease, flight, or fight, if they're not processed and released and let go, every time similar circumstances arises that the body interprets as this is happening again, what happened in the past is happening again, you experience what's called a trigger. And so the body goes back to that past. It actually disrupts time. You are no longer in the present. You are simply responding as if you are back in that traumatic experience again, because your body is trying to protect you from what it thinks is danger happening again, right? And so when we add sexual or sexuality to that, it means we're talking here about attacking someone's, in terms of their genitals, in terms of their sexuality, in terms of sexual activity that may be too much too fast, too much too soon, or too little too long.
And I really like the fact that you broke it all the way down. And this actually reminds me of a theory called original pain therapy, in the sense that at some point in time during the evolution of an individual, there's some trauma, there is some pain that they responded to in a specific way. And until you can articulate and say, okay, well, this really means this, you repeat that cycle of saying, okay, because if this is what worked at that point in time, and even like your terminology, because I've heard fight, flight, freeze, or fawn, and I guess that the fawn would be the appease. So until you realize that, okay, well, this is really this, it's not that, it's this, and you're able to deal with it, you repeat that cycle. And I remember my father talking about the difference, making that distinction between having 25 years of experience and having 1 year of experience 25 times. So there's no evolution in that process. So how do we, I guess, start on our own, possibly reach out to someone to say, okay, well, I know I need help, and we can go specifically to sexual trauma and say, I need help. Do I start this on my own while reaching out for someone? How does someone start to heal?
Right. And so there are many things that you could do on your own to start with, including simply slowing down and recognizing what's happening to you, just being aware. So slowing all the way down and connecting to your breath. And slowing all the way down gives you time to analyze what's happening, recognize that this is a different situation, this is not something that's being repeated. So am I really in danger? Do I really need to respond this way? So it gives you time enough so that you can choose how to respond instead of just reacting. So slowing down, becoming deeply aware of your body, noticing the things that trigger you and what causes that going back in time in your mind. Looking at your patterns of behavior when particular things happen. So for example, for some clients, they don't wear certain colors, just putting on that color on their body because that's the color they were wearing when the sexual assault occurred, just triggers them again. And so make something as simple as much as they can handle of putting on that color and talking the body down through breath, through allowing yourself to tolerate a little bit, taking off the color, see how much more you can tolerate, reminding the body that everything is well. This is just a color. Nobody's attacking me. I am safe. Yeah. So one can start simply being deeply aware, slowing down when you're noticing that you're responding in a particular kind of way, and connecting to your breath and to your breathing, which brings you into the present moment. Because what has really happened is that your body's nervous system malfunctions and overreacts. And so if you can recognize that you were able to control your response and not automatically relive your trauma, then you can begin that journey on your own, and then you can head out to a counselor, a therapist who can then support you further along in that journey where you may find, okay, I've reached a point where I can't go beyond this. I can manage this only so far, but I need more tools, I need more skills, I need more coping mechanisms to heal completely.
And we have about 3 minutes more. Time really flies because I like this listening and taking in. But when in that 3 minutes, I want you to speak to the partner of someone who has experienced sexual trauma, because you literally journeying with that person, and I can see people feeling a sense of impotence, not being able to help, not being able to be there, or because they're starting to deal with their own things sometimes at a point in time. So talk to that person as well. Thank you.
Right. And so that person also needs to provide a safe enough space that allows their partner, especially during a time of trigger, to feel safe and to calm down and to slow down with them. And a lot of times it's not about trying to get them to respond the way you think they should respond. It's really recognizing, okay, what's happening with you? What would help now? What would make you more comfortable? What do you need me to do? Those are the kinds of questions that you want to ask. And sometimes all you need to do is just hold space for that person while they work through calming down their nervous system. So you may breathe with them if they find that helpful or comforting. You may need to figure out how close you need to be next to them or away from them while they begin to attune their bodies to you, to have their bodies remember this person is safe, I chose this person, this is my partner, etc. And if necessary, it may be helpful that they go with them to at least 1 or 2 of their sessions with their counselor or therapist or whatever, so that the counselor and therapist could give them more specific tools that would work for that particular person's challenges. But being a part of the journey, being patient, being non-judgmental, and finding other ways to experience pleasure that are not triggering to that person. And so expanding your belief, making your toolbox bigger in terms of what is accessible to you that you have not tried, that you have not explored, but can still bring sexual pleasure without triggering the person.
And what I find interesting about this is that this actually, it feels as though it ties back to what you kind of started off with in terms of a journey of discovery or rediscovery. Because
yes.
and once again, there's a song, I've been to everywhere, but I haven't been to me. But finding
Yes.
those parts of yourself and finding those parts of your partner that you're able to connect with and rediscover each other at that point in time, I think it's so important.
Yes, correct.
And so we want to thank you so much. I mean, and I'm grateful that we were realistic with the fact that, here, what now? One conversation not going to deal with any of this and not just going to scratch the surface the way that some others may. And hopefully this is something that we're able to lean on you from time to time, engage, because I think so much of this conversation needs to happen. The narrative needs to be taken forward, and there are levels to this. But human sexuality consultant and sex coach Onika Henry, thank you so much. And on behalf of the entire TTT News team, I'm Dike Rostant. This has been In Depth with me. Thank you so much for joining us.